Hello. It is really important that people with epilepsy, their families and carers are aware of the risks associated with epilepsy, as some people with epilepsy are at risk of dying without warning. This type of death is called sudden unexpected death in epilepsy, or SUDEP. It is not well known, but if you have epilepsy or know someone who does, it is vitally important that you know about SUDEP and what you can do to reduce the risk. There are roughly 600,000 people with epilepsy in the United Kingdom. Approximately 1,200 people die from epilepsy each year, and around half of these deaths are due to SUDEP. So what is SUDEP? It is when a person with epilepsy dies suddenly and no cause is found, even on post-mortem examination. The death is unexpected and is not due to trauma, drowning, or other known medical conditions. Most cases occur after a seizure, although in some cases there is no evidence of a seizure. It is not clear what causes SUDEP. There are a few possible explanations. During a seizure, the person may stop breathing, which reduces the amount of oxygen reaching the brain. The seizure may cause the patient's heart to go into a dangerous rhythm, or there may be a combination of both of these factors. The best way to lower the risk of SUDEP is to try and establish seizure freedom. In the UK, 52% of people with epilepsy are seizure-free, but up to 70% could potentially be seizure-free with the right treatment and advice. The risk of SUDEP is higher in some people than others. Seizures are the biggest risk factor for people with epilepsy, and their risk levels are higher if they have convulsive seizures, known as generalized tonic-clonic seizures, where the arms and legs stiffen before jerking uncontrollably, seizures that occur during sleep or at night, a continuous seizure lasting more than 5 minutes, which is known as status epilepticus. However, it is important to know that there are still deaths every year in people who suffer infrequent seizures too. Other factors highlighted by research which can increase SUDEP risk or epilepsy risk levels generally include epilepsy starting in childhood or having had epilepsy for many years, not taking medication regularly and as prescribed, worsening of seizure control, significant lifestyle changes like pregnancy, moving house, or starting university, lifestyle choices such as alcohol and substance misuse or using a bath rather than a shower, irregular epilepsy review and low engagement with healthcare professionals, lack of knowledge and understanding of SUDEP. It is important to know that there are positive steps people with epilepsy can take to reduce their risks with the support of health professionals. You can help reduce the risk of SUDEP and other epilepsy-related risks by following these simple steps. Admit: all people with epilepsy having a first convulsive seizure should be sent to the emergency department at your nearest hospital as soon as possible. Call an ambulance if the person is injured, the seizure doesn't stop after 5 minutes, a seizure follows closely after another, the person has trouble breathing, or if you're concerned about them. Refer. People with uncontrolled seizures should be referred to their GP or specialist epilepsy team for a review as soon as possible. Medicate. Encourage people with epilepsy to take their anti-epileptic medication on time, every day as prescribed by their health professional. Educate. Make sure that individuals, families and carers know about SUDEP and what they can do to reduce the risk, for example by avoiding substances such as alcohol or illicit drugs, and ensure they know about key sources of information and EPSMOM, a smartphone app to help people with epilepsy monitor their well-being and risk factors. Review. People with epilepsy should always attend their regular epilepsy review appointment. Thank you for watching this video. By understanding SUDEP and the simple steps you can take to reduce the risk, you can help us to minimise the number of devastating epilepsy deaths each year.